All right, good morning. In the interest of, say, it's afternoon now. In the interest of being respectful of your time, we'll go ahead and get started here, right on time. My name is Dan Callahan. I work in the communications office of the Board of Animal Health. Presenting today will be Dr. Steve Cavisto on Biosecurity 101, the basis of infectious disease prevention and management. Dr. Steve, take it away.
Sorry, there we go. That's better. Looks like it's the team and a couple others, so that's all right though. Yeah, my name's Dr. Steve Cavisto. I am the senior veterinarian with the companion animal program. So for those who are here for the first time, welcome. And this is if you're here for our other presentations, welcome back. So with that, I will go off camera here and I will start talking about this year presentation. I assume everyone can see the slide number 1 there, or the biosecurity 101. And again, my name is Dr. Steve Cavisto, and just a thank you to Dr. Allie Delheimer. She is our dedicated companion animal field veterinarian. There's a good chance she might be doing, if you have a shelter or work for a shelter or humane society, she might be doing your inspection at some point in the future. So thank you to her for her assistance throwing this together. So I guess I will get started here. So why have a biosecurity protocol? Why won't this work? Changing for you guys at all? I can't. Slide number 1, slide number 2.
There we
Now
go.
we're
Dr.
seeing.
Steve is changing for us.
Okay, thank you. So you want to prevent any kind of infectious disease from entering your facility, or if you are a foster-based rescue, you don't want it in your home, intermingling with any of the other foster animals you might have, or your own pets for that matter. If it does happen to get that being some sort of infectious disease into your facility, your home, you want to try to keep it from spreading to your other animals. And then lastly, you don't want it to get out of your facility or home if that does occur. Then the why is continued. So the diseases affect health and quality of life of the animals under your care. They can be zoonotic, so they can not only affect the animals that you're taking care of, but they can also affect you or your loved ones at the animals in your home or other people in the public at large. And lastly, your reputation and public trust. Nothing ruins the a rescue or a shelter's reputation like a good old infectious disease outbreak. And word of mouth and public PR can be a killer sometimes. So the types of infectious diseases that we're thinking about here, bacteria and viruses, obviously, funguses like ringworm, for instance, intestinal parasites, giardia. Those are the kinds of things that we want to try to avoid. Some of them more serious than others. Roundworm can be pretty prevalent, not necessarily lethal. Distemper can be a big issue. So regardless, the best thing you can do, no matter how severe or contagious something is just try to keep it out. So transmission, and COVID's taught us a lot of things over the last few years, but transmission being one of those, and how far snot can fly when you sneeze. So we're all much better for that knowledge. But directly from one animal to the next, indirect, animal to an object to an animal, a brush, a food dish, something of that nature. Again, sneezing, just onto an object, droplets, and then just airborne, the virus just suspended floating around in the air and then inhaled by the next victim. So things that transmit diseases. So direct contact. We have your vectors. Those are your living creatures or insects, ticks, rodents, birds. Think like ticks, Lyme disease. Talk about, yeah.
You're still on slide 2, is that right?
No, I'm not.
Okay, I didn't
It's
think
not.
so.
All right, thanks. So, can you see slide 3 now? The next one, or does it still stay slide 2?
We're still on why have a biosecurity protocol in place. Slide 2, I believe.
Okay. Any thoughts on that there, Dan?
You know, I was just going to jump in and say I actually am seeing the slides as you've been advancing them. So I don't quite know what the issue could be. I would suggest we just keep moving forward with it and see if they eventually jump forward. At least down at the bottom of the screen, you should be able to navigate forward on the slides as well if you were interested in moving them along. But thank you for pointing that out. So.
Okay, so I guess I was here and then here.
Yep.
Okay. So, yeah, your living creatures, and again, the insects, ticks, rodents, birds, and then your inanimate objects. So this can be your cleaning, your utensils, food bowls, your clothing, anything of that nature, which I believe we talk about on the next slide. Examples of fomites: clothing, cleaning tools, food, water bowls, bedding, and so on. So some concepts to understand. First of all, exposed animals. And these are animals that have had some degree of contact with a sick animal. And that's in quotations, in that the degree of contact required to be considered exposed can vary depending on the disease that we're talking about. And exposed animals, they're not showing any clinical signs of illness. So maybe they just came off a shipment, not necessarily applicable probably in this situation. Maybe they come back from a dog show or something, and there's a potential of an exposure there. Now, quarantined animals, these are animals that are exposed and separated from the general population. And these animals, they're not allowed or should not be intermingling with the unexposed animals or any animals that are showing clinical signs. And any quarantine animal that starts to show clinical signs should be moved to isolation. And then the quarantined animals that remain, the time period would reset then from there. So if we were talking about a 14-day quarantine, a dog in that group pops ill, that dog gets moved off the isolation and the 14 days restarts again. So kind of your animal groupings then, you have your general population. These are the healthy animals. There's no risk of exposure with them. Your quarantine, these are animals that have a risk of exposure. They have not tested positive. They have no signs of illness. And once that quarantine period is done, they can be released back to general population. And then lastly, you have your isolated animals. And these are ones that are clinically ill or have tested positive. So steps to prevent an outbreak, and the bold starred ones are the ones that we'll really touch on today. With quarantine, so they treat those new animals that are returning from public venues as if they were exposed to an infectious disease, and follow the established vaccination protocols within your facility. That probably could be its own individual step, but I'm going to throw it in there with the quarantine one. Isolate any animals that are showing signs of disease, and then follow strict protocols for handling and caring for them. And we'll talk about those a little later too. Infection control, the protocols for employees and visitors, such as protective equipment, hand sanitizers, footwear, clothing, have that available, and then train any staff or visitors on those protocols. Cleaning and disinfecting, doing this regularly, including all the areas. Don't know how often you'll have whelping areas, but I know sometimes a rescue will pull in a pregnant dog or a cat, so that can happen. So cleaning these areas and using the appropriate cleaning products, and we'll talk about those a little bit later too. Pest control, also important, going back to those vectors, those live animals. And then following the veterinary guidance, any protocols that you have set up with your veterinarian, stick to them, and listen to the biosecurity measures that they recommend. And again, once more, making sure everyone and your staff, your workers, your fosters, they all understand the protocols and that are in place, and why can be. I mean, if you know why, that can be helpful in understanding how to do it. So quarantine. So treat new animals and those that are returning from public venues as if they were exposed to an infectious disease. And how long that quarantine should last, it depends. And that depends on what the disease in question is. For instance, parvovirus, typically after exposure within 3 to 7 days, you're going to have sick animals. Upper respiratory, your common kitty colds, if you will, usually within 2 to 10 days, so roughly a week, they'll start to get ill. Kennel cough, anywhere from up to 2 weeks. Giardia, 5 to 12 days, average of a week. And I make a note there that can be misleading, and we'll touch on that in a couple slides as well. And then you get into some of these other ones, like the distemper virus can be up to 6 weeks. Leukemia virus can be months, sometimes years. So that you consider such a variety of incubation periods, it's hard to decide, how long should you isolate these animals. So it's easy if you know what disease you're talking about, then you just isolate them for that period and then you move on. But most of the time, or I guess I shouldn't say most of the time, but if there are times where you don't know, you brought an animal in and you just want to be safe. And ideally, if you isolate for 3 to 4 weeks, I should say quarantine for 3 to 4 weeks, you'll cover most of those diseases that we talked about. But I put an asterisk there, as sometimes quarantining or separating an animal that you just get in on a shipment or bring into a new environment isn't necessarily the best for it in a social sense. So I'll talk about that here in the next slide. And the other thing to mention here too is all of this does not consider your asymptomatic carriers. And so that could throw a wrench into problems too. So the asterisk, in a shelter setting, when you have, or rescue foster, when you have a relatively quick turnaround, if, example, someone from Humane Society was kind enough to share some info with me, if you have an average of 21 days that an animal stays with you before they move on, and you're quarantining or isolating it for 14 days, that's a significant chunk of the time it's with you, and that's lost time for socialization, which is not an ideal situation. So we kind of have to weigh the benefits of quarantining, isolating that animal against the the socialization time that's going to be missed, and the extra stress it's going to put upon that animal. So it's might be best in this situation with rescue shelters to just vaccinate upon intake. So you follow your vaccination protocol, vaccinate for what you can, your parvos, your distempers, kennel cough, whatever it happens to be. Monitor those animals carefully for any disease, test what you can feasibly test for, feasibly being expense and also what's available. Some things we just don't have a good test for. At the first sign of illness, isolate those animals, and obviously the ultimate goal, regardless of whether we're talking about illness or not, is to get them adopted out as soon as you can. The sooner they get out, the less stress that's on them, the less likely they are to get exposed, and therefore the less likely they are to get sick. So going back to these asymptomatic carriers, that they can throw a wrench into plans. So there are some diseases where an animal can become some clinical or asymptomatic carrier and past the expected incubation and recovery period. And so those animals can be infectious to other animals without showing any clinical signs themselves. Couple of examples, like distemper virus, which is, probably of the three that I have listed here, for sure the most serious. After recovery, the dogs can shed the virus for 3 weeks to 3 months. In some cases, it's been indicated maybe even up to 6 months, an average of just over a month. So that animal can look perfectly healthy, but it's shedding virus, and you definitely don't want that in your facility, which goes back to following your vaccination protocols. It's a very preventable disease. So vaccinating, touching on it just a little bit more, vaccinating is key to help prevent something terrible happening. Giardia, dogs can become chronic carriers. They tend to intermittently shed the parasite, again, not necessarily showing symptoms. And brucellosis, these dogs, they can live lives, very, very long lives, healthy, but yet intermittently shed bacteria. And again, this is not something you want in a facility, and you don't want to be adopting dogs out with that either. So the number one thing to do in the face of an outbreak is isolate the sick animals, get them out of the general population. It's essential to stop the further spread of the disease. So having an area, an isolation room, if you will, that these animals can go to is very important. But it's also important that the room is used properly, and the people that are using it are trained to use it properly. So the animals that are in isolation, they should be handled with the proper protections in place, whether that be gloves, gowns, boots, whatnot. You shouldn't use cleaning utensils or food bowls or dishes from the isolation room and then go into the general population and clean. And you should do cleaning and disinfecting and caretaking in the correct order. So, and if these steps aren't followed, then the isolation room really isn't isolated. It's just a room you put sick animals in, and you're just hoping that it stays there, it being the illness. So the correct order when cleaning or caring for animals would be start with the unexposed, so the healthiest, if you will. Move to those that are exposed or quarantined, and then lastly to the isolated or sick animals. And logically, if you look in the reverse order, if you start with the sick ones and go back the other way, you just are potentially spreading disease. Minimize the traffic into the room, limit the number of people working with animals in isolation. If possible, assign the care to one or two people. and make sure the room is adequately supplied with what you need, whether it's food, bedding, dishes, any kind of protective gear, boots, shoe covers, whatnot. And I should say this is applicable to a foster as well, in the sense where if you've got a separate room that in your house that you keep the sick animal in, away from your general population and other animals, I would, these things all would apply there as well. It might be harder to clean the floor, for instance, especially, if you're in a carpeted room, but following some of these steps is certainly going to help prevent that from becoming an issue in your households, so, as it were. So, and then minimize the risk of movement of the pathogen from out of isolation. So, having some ability to wash your hands, clean your hands in that room, whether it be hand sanitizer or a sink. Again, don't use the cleaning tools or utensils or dishes from isolation elsewhere, and use the gowns, shoe covers, and whatnot. And avoid using foot baths. Foot baths used to be kind of the standard. I remember in my vet school days, and outside ICU or isolation, there'd be a bin with bleach water sitting on the floor that you stepped in and walked on. And finding now that that's probably more of a breeding ground than it is um, a sanitary condition. I left this picture here because I was looking for a picture of an isolation room, and when I made that search in the PowerPoint, this came up. And so if anyone can figure out why, I would love to know. But I suppose maybe it was avian influenza, an egg beater isolation. I don't know, but I thought it was interesting. And that doesn't make any sense, kind of sense. So foot baths, going back to those again, for any disinfectant to work, it requires contact time. How many people step in a foot bath and stand there for 5 minutes? I know I never did. And many disinfectants, including bleach, are deactivated by organic matter. So if there's fecal matter in there, or if that's not just bleach and water, it can inactivate it and make it useless. So your best alternative is to use shoe covers. So they tend to be inexpensive and they're easy to use. Barring that, you can have a pair of boots that you just leave in that bin. If you're going to use a foot bath, just make sure the foot bath is clean, and just take those boots off and leave them there. If you do use shoe covers, just remember, if you take them off and put them in your pocket and walk around and you're putting your hands in and out of your pockets, you're basically bringing their isolation disease friend with you. So it's best to throw them away right outside isolation and try not to reuse them. So another key to preventing an outbreak, regular cleaning and disinfecting, keeping the area clean on a regular basis. It helps to keep the potential for infectious disease down. Obviously, it controls odors. If we're talking about slippery surfaces, keeping urine and stool off the ground can help prevent injuries. Going back to that public reputation, if someone comes into a shelter or humane society and it smells and it's messy, we know that happens. Working in a vet clinic, it's not very often. If you've got animals in there isn't some sort of bodily fluid somewhere, but the general public doesn't necessarily understand that. And controlling parasites and pests. So doing those things are important on a regular basis. And going back to then cleaning versus disinfecting is kind of a key here. Cleaning this is where you're manually removing any kind of organic matter, the feces, urine, blood, dirt, the food remnants, Next, generally done with just soap and water. That's all you need to do with that. And disinfecting being, that's when we're removing the pathogens themselves on the surface after it's been cleaned. So it's typically done with an application of a disinfectant mixed to the proper dilution and left applied for their specified amount of time. And both of those depend on the disinfectant that you're using, and following the labeled instructions will tell you what to do as far as concentration goes. Just a quick note on these non-enveloped viruses, and this is important because they tend to be environmentally hardy. They're hard to kill. Also known as naked viruses. They lack an outer envelope or a coating, which, as I think about it intuitively, seems like it would be the opposite. But this protein coat that they have, rather than this outer envelope, because I guess it's been described to me as sort of like if you walk around barefoot, you develop calluses on your feet. They become tough. So this protein coat, because it's constantly exposed to the environment, is tough. And so it's hard for some disinfectants to get at the innards of the virus to kill it. So then distinguish that from your enveloped viruses, which they have a lipid or a fatty membrane surrounding them. And this fatty membrane also is an area that disinfectants can work on. So it's another reason why envelope viruses tend to be a little easier to kill. So the key there is the non-envelope viruses are more difficult to eliminate. And just a pretty picture to express that on the left being an envelope virus with its nice lipid membrane, and then on the right is one that just does not have it. These little spikes and whatnot, so kind of the areas that antibodies will identify what the virus is to the immune system, and the genetic material kind of hiding in the center there. So examples of non-envelope viruses, some of them probably sound familiar. Parvo, for instance, your kennel cough, your adenovirus. Kennel cough is not the virus itself. It's a disease, usually a combination of, but the viral portion of kennel cough is a non-envelope virus. Canine hepatitis, another adenovirus, is also non-enveloped. In the feline world, the feline distemper virus and the calicivirus, which is a common upper respiratory virus, which is, again, why shelters and humane societies can have such a struggle with upper respiratory infections, because the virus is hardy. So in the world of disinfectants, your best bet, quite honestly, is using the accelerated hydrogen peroxide products like Rescue or Excel. They have good activity even when organic debris is present. So if your cleaning processes are suspect, these will still do you some good. And so on that note, they can be used both as a cleaner and a disinfectant. If you do have goo laying around, the contact time necessary to kill the viruses, the pathogens, needs to be increased. So cleaning is still important. So just especially if you don't want to sit and let something sit on the ground for 15-20 minutes. And they're also effective against the non-envelope viruses and ringworm. So the concentrations generally tend to need to be higher with things like ringworm, but these products, usually right on the label, will tell you what dilution you need to do to take care of what pathogen you're discussing. The other nice thing about it is once it's been diluted, it has a long shelf life, so 90 days. And if I remember correctly, though, this is important to keep it out of direct light, as light can deactivate hydrogen peroxide. The next one, the potassium perioxymonosulfate, like your Virkon or trifectant. They're somewhat effective when there's organic debris present, but a little less so than your rescue or your Excel. They are effective against the non-envelope viruses and ringworm, but have a shorter shelf life, much shorter shelf life after dilution. So only 7 days, which is why I would suggest using rescue or Excel. Bleach, is kind of the old go-to, but it's not really recommended. It's not, it is effective against non-envelope viruses, but the concentration you need for like ringworm is really high. And any organic matter, your urine, your feces, food, whatnot, will make bleach useless. And so the surface must be completely clean for it to be effective. Your quaternary ammonia products, Parvasol, Maxon, or your chlorhexidine alcohols, none of these are effective against the non-envelope viruses or ringworm. And cats are known to be sensitive to the quaternary ammonia products and chlorhexidine. So if you're dealing with cats, it's even more important to kind of stay away from these products. So concentration and contact time, again, it's important to follow the instructions on the label because it can vary from one pathogen to the next, even with the same product. And more is not necessarily better. So just using a super concentrated mixture, it can be harmful. The residue can stay in the environment longer. It can be irritating to the animal once returned in the cage, and they can just be noxious. The fumes for the people who are working with them. So more is not always better. Just use what is necessary, and your product's going to last you longer too. So I just want to touch a little bit on the canine distemper virus, just because as I sit on a daily basis, my email pops with alerts with particularly down south, right, in Texas, and I think was it Alabama, even I think Southern California, a lot of areas of shelters are dealing with it on a regular basis. And so Dr. Cinda Crawford, she's from the University of Florida. They have a shelter medicine program there. She was kind enough to do kind of a quick presentation for myself and a few others, kind of discussing what to do with animals in these shelters when they have an ongoing outbreak. And she kind of nicely summarized it. I don't recall if she called it the stoplight classification, but since she used the colors red, yellow, and green, I decided that I would call it that. The red animals, these are animals that are clinically sick and they have not been vaccinated. There's a fairly decent chance they're not going to survive. And if they do survive, don't import them. We don't want them to come here, at least not at the state that they're in at that time. So now if these red animals do survive and they move on to yellow, so these animals that they are not sick, they have been vaccinated, but they have no detectable distemper antibodies. And what in that situation, then that means that we don't know yet if they've been exposed, but we do know they don't have any detectable antibodies. So even if they've been vaccinated, they're not ready to move. So retesting in 2 weeks, and if antibodies are present then and they're not sick, then they're good to go. So they're okay to be imported. If they don't have antibodies yet, then don't import and retest in 2 weeks. Animals that the green animals, they've been vaccinated, they have no signs of illness, and they have antibodies present on a blood test. So we know that either they've been exposed and recovered, or they've responded to the vaccine. So these animals are safe and they can move on. So sadly, generally, she recommends when they're dealing with an outbreak in a facility, the red animals are typically euthanized, as they are they're not likely to recover, and they are a major risk for animals that haven't been exposed. No matter how hard people try to isolate or be careful moving around, it just seems to spread like wildfire. So you don't want it in your facility. You don't want it in your foster home. Uh, and we're lucky enough up in Minnesota right now that we don't get a lot of outbreaks. I don't recall the last time there's been a major outbreak anywhere, but a lot of that comes down to vaccinate, 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 and and just there are shelters and rescues are careful with that. So on that note, I will just kind of throw it out there for any questions anyone might have, including my team.
Yeah. All right, folks, if you have questions, you can feel free to drop them in the Q&A. Excuse me. And Dr. Steve will handle them as we go through.
And I will just share, I'll try to share one more thing here. Can you see this this web page? Is that popping up now?
It is not popping up.
Okay. Now?
I feel like it's thinking. It's just
Is
a
it
black,
thinking?
yeah, it's just a
Okay.
black screen right now.
Okay. I'll just I would sing, but no one wants to hear that. So, and I don't have any really good jokes that I should probably share. So maybe if it's still getting you black screen, I'll try this one. Any change there? I was just a couple of websites. I guess I could just use words. The University of Wisconsin-Madison, the School of Veterinary Medicine, they have a shelter medicine program. And you just Google it, you'll find it. There's a lot of good information on there. They also have they have a document regarding H5N1 in cats and steps to take to help make sure it doesn't get into your facility, what to do if you suspect you have a cat that's H5N1 positive. So there's some good information there. And they also do provide community support. So if you have questions, you can reach out to them and they are happy to answer them. And then the University of Florida, they also have a shelter medicine program. And there's others, but these are the two that come to mind off the top of my head. Cinda Crawford, the doctor who gave me us the distemper information. She works there and she runs their shelter medicine program. So I will stop sharing that since it doesn't seem to be working anyway. So on that note, hadn't seen any questions pop up anywhere, right?
I'm sorry. No, sir. It does not look like we have any questions popping up in the chat. Just to let those who are attending know, you can feel free to send questions if you have them after the fact to Dr. Steve, and we'll put that email address right here in the Q&A section as well. And if you do have questions, then going once, going twice.
And a third time. Well, thank you. Thank you for those that came. I can see who you are. So thanks for coming. Yeah, feel free to send me if you have any questions, send me an email. I'm happy to answer them. If you have any ideas for future topics you'd like us to discuss in any future webinars, let us know. Be glad to go through that, or I should say, look through that and then come up with something for you. So appreciate your time and thank you very much for coming.